Welcome to the Plant-Free MD podcast with Dr. Anthony Chaffee, where we discuss diet and nutrition and how this affects health and chronic disease, and show you how you can use this to optimize your health and happiness, both mentally and physically. Hello, everyone. Thank you for joining me for another episode of the Plant-Free MD. I'm your host, Dr. Anthony Chaffee, and today I have a very special guest who is going to tell us her story. Lynn, thank you very much for joining. It's a pleasure to have you on.
Thank you so much for having me.
Welcome. So for those who haven't come across you before, can you tell us a bit about yourself and what brings you here today?
Yeah, absolutely. So I'm 56 years old, been married 34 years, mom of three, grandma of three, adoptive parent. And I have been a carnivore since the end of May of 2023. I attribute carnivore diet to saving my life, saving me from at least a long, miserable life full of suffering, if not saving it completely. I was a nurse and had worked in hospitals, but then my last 7 years as a nurse, I had worked in outpatient nursing in a gastroenterology department, GI hepatology, and had been dealing with odd symptoms and health problems my whole adult life, and ended up on disability, completely disabled in 2022, June of 2022, which forced me into early retirement from nursing. And I did get a diagnosis, but it was 35 years of suffering before I finally got a diagnosis. And um, after being on disability, it took me about a year before I found the carnivore diet and finally started to see improvement in my health. And it's completely changed my life.
Great. So if you don't mind, obviously these are very personal things, but can you describe some of the things that you were suffering with and how that affected your daily life, and then what changed and how that looked for people that might be going through the same thing?
Yeah, absolutely. So the symptoms started when I was in my 20s, and throughout the course of my 20s, it manifested in severe heat intolerance, severe exercise intolerance, excessive fatigue, infertility, severe anxiety, a lot of menstrual irregularities, and I was diagnosed with depression too, but I think anxiety was the bigger thing with me. But I lived down in California at the time, and the Central Valley of California is pretty warm, but I noticed that my ability to handle the heat was just non-existent. I would go very soon after being out in the heat, I would be almost in heat stroke range as far as symptoms go. And I would try to exercise. I'd feel worse. It would knock me out for days, sometimes a week of trying to exercise. I had started to gain weight as well. I was diagnosed early in my 20s with polycystic ovarian syndrome, but never responded to treatment. Um, in my 30s, I did end up with a complete mental breakdown.
Hmm.
The way everything affected my brain, it was odd because I had these panic attacks that were just this spontaneous panic attacks, and I never felt like they matched my emotions. It was like my body just took over and launched me into a full-blown panic attack, and didn't feel anxious. I was happy. I didn't, yeah, it was just seemed like I would even go into a panic attack in the middle of the night in my sleep, and it would wake me up. And I ended up having just a complete breakdown in or my early 30s, and I ended up just leaving work and telling my coworkers I have to go. And I drove myself to a psychiatric hospital, and I told them I am convinced that I'm going to die. And they admitted me. And so I ended up 5 days in a psychiatric hospital. By this time, we had adopted two of our kids. And I mean, life was stressful. We adopted special needs kids out of the foster care system. They were a little bit older when we adopted them, and they had both been through abuse. You know, we know now they both have PTSD. And so it wasn't, I did have stress. Um, but I thought I was coping pretty well. But that completely just wiped me out for years. And I did go through a lot of therapy, was on every psych medication there was, and but just continued to gain weight. My energy levels were like chronic fatigue levels energy. And I was always looking for an energy source. And so my eating was usually seeking something that would give me a burst of energy. And of course, it would never last. But so then I'd go back to something else. And it was always garbage food. It was always very carb heavy, sugar heavy food. And so I continued to gain weight. When I was before my 20s, I'm 5'8". I was about 150, 160 pounds. So for me, that was a very good normal weight. And over the course of the decades, by the time I was on disability, now in my 50s, my weight had blossomed up to about 350 pounds. So I had put on 200, almost 200 pounds. But I continued to push through all through my 40s. And in my 50s is when I really started to have some bizarre symptoms. And I had learned to just adapt to the heat intolerance, learn to adapt to the exercise intolerance by not exercising. The fertility issues, and menstrual irregularities were still there. The anxiety, I kind of got it under control pretty well. I wasn't having full-blown panic attacks, but there was still this underlying sense of anxiety that was there. And so when I was in my 50s is when the symptoms started to get really strange and escalate. And um, I started having dizzy spells and heart palpitations, severe tachycardia, severe hypertension. And the first time it happened, I was working in the hospital. And so my fellow nurses just like, they came to the rescue. And then the charge nurse put me in a wheelchair and wheeled me down to the ER. And they couldn't find anything specific. So the doctor said, well, it's probably your inner ear. So they sent me home with meclizine and didn't do anything to help. And so I ended up going to see a neurologist, had a brain MRI, ended up with two brain arm MRIs. They didn't find anything unusual. Although I was having some weird kind of that almost like seizure type symptoms. The doctor thought, the neurologist thought it might be a type of seizure. It was kind of an out of body type experience that would happen here and there. And it was almost like deja vu, where I would just feel as though I was re-experiencing something, but it wasn't anything specific. I just had the feeling that I was out of my body and I was experiencing something that I had experienced before. And so the doctor said, well, I want to put you on some medication for seizures. And I declined. I decided I don't want to be on any of that medication. So I just dealt with it. It didn't happen that often. But then I was just frustrated because the episodes with the dizzy spells were starting to happen more frequently. And I ended up a couple years later, and again, this is me. I mean, nurses are terrible patients, I'm sure doctors are terrible patients too. We tend to be, but I just tend to push through things. I was a mom. At that point, I had two teenagers, older teenagers, and I was working and trying to function. I was gaining so much weight that I was struggling. I worked in a critical care and I was bumping into equipment. I got injured because I just was not in good condition. Moving a patient really messed up my back and my wrist. So I ended up going to outpatient nursing. And in outpatient nursing, I was doing a little bit better, but I started experiencing flushing and horrible rosacea and then throat swelling episodes. And my coworkers were very worried about me. They thought maybe it was menopause, and I got my blood work done and I was not in menopause. And but the throat swelling was a new symptom for me. And the first time it happened, I was at home and I called 911, took a Benadryl, and the EMTs came and, my heart rate was very elevated. I don't remember what it was, but I know my blood pressure was 220 over 120. it was really high.
Yeah.
They took me into the ER and ran a battery of tests. The only thing that came back negative was a serum tryptase. And so the doctor said, sent me home with prednisone and Benadryl and sent me to go see an allergist who is an immunologist as well. And the doctor or the allergist said, possibly you might have mast cell disease of some sort. And it took a couple more years to get to diagnosis. And during that time, and it's hard to diagnose mast cell disease. I mean, the doctors are very familiar with systemic mastocytosis, and it's it was a concern that I possibly might have systemic mastocytosis because we did retest my tryptase and it was over 20. And I guess the 20 is the cutoff for a concern for systemic mastocytosis. So I did end up getting a bone marrow biopsy.
Mm.
Um, and I did have to, and which came back I did not have a systemic mastocytosis. So the doctor said, I think you do have mast cell activation syndrome. Well, we did a 24-hour urine collection looking for uh, mediators in my urine, and that came back, one of them came back positive. And I did a genetic test, and it turns out I also have hereditary alpha tryptasemia, which is kind of related. It basically means that when my mast cells degranulate, I produce extra copies of tryptase, which is one of the many, many chemical mediators that a mast cell releases. And so I had gotten the diagnosis. My coworkers were always very worried about me because I had the most horrible rosacea. I would flush so easily. I was barely functioning. And I was looking at possibly needing to change jobs to something less stressful or do something different when I got an infection. And the infection sent the mast cell disease into a horrible flare. And I could not speak. I couldn't speak. I couldn't get my words out. I was stumbling. My brain would freeze, and I was on the phone with patients a lot. I did a lot of triage over the phone and patient care and patient management over the phone. And I would freeze right in the middle of a phone call with the patient, or words come out that I didn't intend to have come out. And I was experiencing symptoms in pretty much every system of my body because I was having heart palpitations, severe abdominal cramping. I had bladder irritability. My skin was I mean, I looked like a leper. My face now is nice and clear, but I look like a leper with all of the blotches, um, tinnitus, sinus issues, um, bone pain, muscle pain, joint pain. I mean, the fatigue, the brain fog. It was just every part of my body was just not functioning well. But the infection just put it over the roof. And so I could not work safely as a nurse any longer. And that's when I went on disability. Um, and so for the first year on disability, I was just on antihistamines. I was on some medication that the allergist gave me, and the allergist really didn't say anything other than take these medications. Didn't say, let's identify your triggers, didn't do any additional testing for what other exposures I may possibly have had. Just said, come back in a few months if you're not feeling better. And so my only tool at that point was H1 and H2 blockers, and I was on some Montelukast. But I started to see a naturopathic doctor, and because I really just wanted to learn more, and I dug in and I started to listen to the doctors out there that are the experts in mast cell activation syndrome. And I learned a lot from them and learned about what it actually entails and how important it is to identify the triggers. Also, how common it really is. It's really the quote I keep hearing is up to maybe 17% of the population
Wow.
actually has mast cell activation syndrome. And it's one of these illnesses that's incredibly common, but just underdiagnosed. And Dr. Lawrence Afrin, who's probably the leading doctor when it comes to mast cell activation syndrome, his theory is basically that when they're still thinking systemic mastocytosis, which is rare, when they hear about a mast cell issue. They kind of dismiss it because it's like, no, that's so rare, you don't have it. But mast cell activation syndrome is not rare. And I've learned that hereditary alpha tryptasemia is also not rare. And so together, they have this conglomeration of symptoms, and everybody, there's a lot of crossover with symptoms, but there's people that can have absolutely opposite symptoms and still have mast cell activation syndrome. So for example, I have a milder version of polycythemia, which is really common with mast cell activation syndrome. Someone else with the same condition can have anemia, and you can have opposite presentations in people. And so it's very difficult to diagnose. But the naturopathic doctor that I saw was really willing to learn about it and dig in. So we did a mycotoxin test, which I tested positive for mycotoxins. Um, we did a professional mold inspection in our home, which came back clean. So not 100% sure. It may have been my CPAP machine, which I forgot to ask them to test. It may have been my CPAP machine that was the source, or possibly I just don't clear mold very well on my own. Um, but I ended up learning these things that, okay, maybe the mold is a potential trigger. Obviously, the infection was a trigger. I know that UV rays could be a trigger for me because I could be out, and I live in Washington State and it doesn't get too hot. I could be out on a 70-degree day, but if it's sunny, I could feel like I'm going to pass out and can't and have to go home really quickly and get out of the sun. So I learned all of these different triggers, but I didn't have, and nothing was really working. It was really a matter of lay around, stay inside, try to avoid life because you never know what's going to set me off. And I was tired of calling 911 because there was trips to the ER, and the doctors at the ER, they didn't necessarily know what to do. Um, I tell them I had mast cell disease, and the first thing they thought was the systemic mastocytosis. So fortunately, I found the Mast Cell Society website. It's called tmsforacure.org, and they have an emergency protocol. And also a pre-procedure protocol. And so the last time I had to go to the ER, I brought the protocol with me. So it was helpful. The thing that really got my symptoms under control was IV famotidine, because I had my blood pressure come down, my heart rate had come down, the throat swelling had subsided with dissolvable, like rapid dissolved Claritin and chewable, and actually it was just rapid dissolved Claritin at that time. But I had this sensation that every cell in my body was vibrating. And I hear that a lot from people with mast cell disease, is that you feel like every cell's vibrating. And the IV famotidine took care of it within like 10 seconds. And so I started to add a chewable famotidine to the rapid dissolved Claritin, and those were my rescue meds. I've never had to use my EpiPen, which I do have, but those were my rescue meds. So from then on, anytime I'd start to feel throat swelling, I would pop the Claritin and chew on the famotidine, and that would take care of it. No more trips to the ER, but I was still miserable. I was gaining weight. I couldn't do anything. I was in constant pain. I wasn't really getting better. And in May of 2023, after it had been almost a year on disability, my husband said, "Why don't you try a carnivore diet?" And I had tried a carnivore diet back in 2021 for about 6 weeks, did great, but I stopped doing it. And at that point, in my mind, I thought that it was just for weight loss. I didn't realize it could heal your body like it does. And so when he came to me in May of last year and said, "Why don't you try a carnivore diet?" He came to me with some YouTube videos of people who had experienced actual healing from autoimmune disease. And that really caught my attention. That's why all these stories are so important. And so I said, "Okay, I'll try it. If you will try it with me, I will give it a try." And I decided to hold myself accountable by starting a YouTube channel and just start reporting everything that was going on. And that started my journey towards reclaiming my health. And so since I started out, when I first started, I was having to take those two rescue meds, the Claritin and the Pepsid, 2 to 3 times a week for throat swelling episodes. And it went down to about twice a month. And my rosacea was still, it was very slowly getting better, but it wasn't getting better to the point where I was happy with it. I was still looking pretty bad. And I just was like, there's something missing. I just feel like I'm not quite getting the healing I need. It's getting there. So I decided to try the lion diet. At that point, I was still eating bacon and eggs, and I was eating chicken a little bit, although chicken was sometimes would make my throat swell. Um, but and I was eating a bunch like aged cheese. I was eating smoked meats. And I just said, look, I need to just cut the histamine down, go low histamine and go the lion diet. And that is when everything just totally turned around. My rosacea cleared up, which I really believe is a reflection of my gut because I was in constant gut pain, and my gut healed and the episodes went away. I didn't have to take any of those medications. No, no more throat swelling. Everything cleared up. And I've lost over 100 pounds. Um, and it's just been unbelievable. I feel as though I found, the pot of gold at the end of the rainbow,
Mhm.
because I'm now 56, and my whole adult life, I was miserable, suffering, fatigued, in pain. And it seemed like nothing in my body worked until I found this.
Hey everyone, really happy to announce a new sponsor for the show and for everybody down in Australia, Stockman Steaks, who are delivering high quality grass fed and finished pasture raised beef and other meats, flash frozen and vacuum sealed to your door, something that I've been enjoying a lot of myself recently as well. They also have a great range of specialty items such as high fat keto mince and carnivore beef and organs mince with liver, kidneys, and beef heart as well. So use code Chaffee today for a free order of beef mince or another specialty gift along with your order at stockmansteaks.com.au, and I'll see you over there. Thanks, guys. Yeah, wow. Well, I mean, understanding just how this afflicted you. I mean, obviously it's massive. It took over your entire life. There's nothing you can really do. People who haven't gone through that really don't understand it, really haven't had a family member who's had to go through that, really can't understand how impactful that is. And having all these very well-meaning doctors and very helpful people that are doing the best that they can, and but they're using the tools that are available to them. It's just it gets you as far as it can and no further. And so having something else that you can find to give you an outlet to get away from that is amazing. I'm really glad that you were able to find that. So it sounds like you need to be pretty strict. You said that you really found the best healing when you went full lion diet, just red meat and water, and even chicken can set you off. Is that the way that you're eating now? Do you still have to stay that strict?
I had to be that strict for about a year.
Okay.
And then when I started to try to just experiment around with a few things, and I kind of used my rosacea as a gauge, because I just really like I saw that connection between my skin and my gut. And once my rosacea cleared up, I felt like, okay, I think this means my gut has healed really well. So let's try some things. So I added back eggs, because I was occasionally I'd have an egg yolk because the yolk is low histamine, but I added back eggs and I'm doing okay with that. I can have bacon a couple times a week. I have to be careful because it is higher histamine. I have tested the boundaries and found that I really need to limit it to just a couple times a week. I can have organic chicken. I have to make sure it's organic. Um, and occasionally I do have some cheese, but I try to stay as much as possible away from the dairy because I still have about 50 pounds left to go, um, before I think I'm probably more at an ideal weight. And weight isn't the primary thing for me. I mean, the weight loss was a happy side effect. I'm thrilled to have lost as much weight as I've lost. But it's the functionality in my life that's the most important thing. And the fact that I can actually go out. Before, I was not able to ever commit to anything. If I'd get invited somewhere, I had to say maybe or no because I never felt good and I was always reacting to things. And so now I can commit to things. I have a life. So that's way more important to me. But the
Mhm.
food, sometimes I do coffee, other times I don't do coffee. I found that the coffee, I do better with decaf if I do coffee. I found that the caffeinated coffee actually increases bladder irritability for me. So my bladder was really bad. Like it would just release its contents without any warning. And that makes it so you don't want to go out either. I mean, it happened to me in a restaurant one time and it was just mortifying to have that happen. And when that wasn't happening, it would just be so urgent that often I wouldn't make it in time to the restroom, which was horrible. You don't want to have to be in your 50s and needing to wear Depends. But that was reality. And so I I will do anything to not have those symptoms coming back. If I have to eat one food for the rest of my life, I will, because I can actually function now. And even if I didn't lose any more weight, I can function. I can fly in an airplane and I can, sit in chairs in any restaurant, which wasn't the case before. And but the sense that I can actually go out and not have to worry about can I go to this place or is it someplace where it's going to be hard for an ambulance to get to me? That was a lot of it sometimes, because sometimes I'd be invited to go. We live in Washington, Washington, there's all sorts of places to go and hike. And, I gave up an opportunity to go on a carnivore meetup with Amanda from Carnivorous Me on a Mount Rainier. There's like a little train track, and you can get on these little cars and you can bike. But I wouldn't go. This was earlier on. I wouldn't go because I was going, if I have an episode, how is an ambulance going to get to me? And these episodes are so it's so scary. The throat swelling episodes with is it is so scary. You do not want to be someplace where you don't have access to emergency care. And so I don't have to worry about that anymore. And that means everything. Yeah.
Yeah. Well, that's really good. Well, I'm so glad that has given you that back. That's especially living in Washington. Washington's such a lovely state. There's so many natural, beautiful things that are yonks away from the closest hospital. So, being restricted by that is it's a real practicality. I mean, people as they get older have to sort of think, okay, we're going to move. Am I going to live on a road that has good ambulance access or something like that? What if it snows? Is that going to be difficult or anything like that? And being in a good district with a hospital that's nearby, those sorts of things. Those are real issues, but having that be your day to day where you can't even go on a hike because it may be too far away from a hospital, or you may not have cell service to get an ambulance or something like that. I mean, that's obviously extremely limiting. Um, well, I'm really sorry that you had to go through that. I'm really happy that you recovered so much. That's really great to hear. Um, so you were a nurse. Did you go back to work, or are you still out?
No, I didn't go back to work. And I have to be very careful with the stress levels in my life, but
Mm,
that's not the main reason. The main reason is because, when I did have to quit work, my boss said, hey, if you're better and you want to come back,
mm,
if there's an opening. And I was the head nurse, and I
mm,
was a nurse preceptor, on my team. There were 7 of us, and it was hard. I loved my job, but I couldn't go back now because it was gastroenterology.
mm,
And I mean, I was helping in gastroenterology patients, and we had a lot of people with Crohn's disease and ulcerative colitis, and I was, helping all of these patients with IBS and telling them to eat their grains and their fruits and their vegetables and make sure you're getting plenty of fiber. And I can't do that. There's no way I could go back to that and feel good. I'd get fired because I would be telling the patients to stop eating those things. And I'd be trying to find a way to tell them to stop eating those things because of what I know now. I just can't do it. And so I am very fortunate that I am working with Carrie Mann and Adam Lacey with Healing Humanity. And so I've gotten in with their group and I have been working with them with the documentary, the Healing Humanity documentary, and their new membership site. I'm the site administrator for their new membership site. And so I feel like just through all of this is through just having a channel. I just got connected with the carnivore community, which is an amazing community, and it's given me an opportunity to get the word out about the carnivore diet and hopefully reach some people who have similar symptoms to me and who I found that with people with mast cell activation syndrome, there's a common thread, and that's that they often have been to so many doctors with no answers, or you'll get a diagnosis, but the treatment won't work. And so every time I have an opportunity to share my story, there's always people in the comments that say, "Oh, wow, I think that's what's going on with me." And so part of what I want to do is to just let people know that this is an actual real condition and that it's so often not diagnosed. And I'm not saying that you have it. I'm just saying that, like, add it to the list of possibilities that this may be what's going on, considering how common it is. So I feel like I have an avenue to help more people with something that can really help them more so than I did when I was working as a nurse. And not that I didn't love nursing, but this is something that can actually really heal people. And to me, that's so exciting.
Yeah. Well, it is exciting, and I'm glad that you are getting out there because I'm still in practice. I still see my patients, pretty much every day when I'm not doing conferences and things like that. I'm pretty much work 7 days a week, either at my clinic or online. And so I'm still seeing patients, and I love that aspect of it. But and there's a lot more you can do when you're face to face. Obviously, you dig into their blood work, you can sit down, spend a lot of time with them. You're seeing them repeatedly, all these other sorts of things, and so you can really help people out significantly. And if there's more issues than just their diet and lifestyle, then obviously that's something that can be addressed during those consultations. But you're right, just for sheer reach, speaking to people online, doing videos like this and others, and having a YouTube channel and getting your voice out there, working with people like Carrie and the Healing Humanity people, and getting this wonderful documentary out. I can't wait until that comes out. That's going to reach a lot of people, and that's going to have a huge impact, and could quite possibly have an even bigger impact as far as just sheer volume of people. So yeah, if you're in a situation when you're in just the general hospital system and you're beholden to the rules and regulations and policies of that hospital, then obviously
Right.
it's much more difficult. And when I was in the hospital, anytime I would do rounds or see patients, be in the ICU, and you just see the garbage that they get fed, it would always just pop into my head. I'm like, this is why you're here, because because you're being fed that
Right.
garbage.
Right. And I remember very frequently there would be doctors and nurses that would talk to that way, but in respect to obese patients
Mhm.
or with respect to diabetic patients, but they wouldn't make that connection with cardiac patients, stroke patients, people that
Mhm.
were experiencing other types of conditions. They did not make that connection to the diet.
Mhm.
And now that I see that connection, you can't unsee it.
Mhm.
And it's a little different too as a nurse, because as a nurse, I have to follow the doctor's orders. And so I don't have the bandwidth, not the doctors do either, because doctors are, they're told what to do. They've got their guidelines and their algorithms, but I'm more limited as a nurse as far as what I can do. And especially since my last job was in an outpatient setting and I was talking so much about nutrition to patients because I was working in gastroenterology. Um, Amazingly, the doctors would most of the time they would tell patients, it doesn't really matter what you eat. I mean, they'd encourage them to eat a well-balanced diet, but it was always make sure you're getting your whole grains, make sure you're getting plenty of fiber and your fruits and vegetables. And the only time that they had them restrict fiber was if they were in a IBD flare. Crohn's or ulcerative colitis would flare up and they were, obviously inflamed. And at that point, they would say, okay, back off on the fiber. But that connection, but like it was never made that maybe they should just stay off of the fiber.
Yeah.
It was, and I never made that connection either. I mean, I was just as bought into the whole nutrition component of gastroenterology as there anybody else was. I
Mm.
just, I didn't see it. But looking back, I do see the patients struggling. And I can't tell you how many times I would have a patient tell me, I've tried all that. I've tried the fiber. I've tried, and it just doesn't help,
Mm.
especially irritable bowel syndrome patients. They would be like, nothing is helping. And now I've heard so many stories of people with IBS and it clears up on the carnivore diet. I've had IBS
Mhm.
and myself. I know how miserable it is. And I don't have that on the carnivore diet. So yeah, it's something that, and it's hard to think of going back to nursing with what I know now, especially in the area that I was specializing in. And but I wish I could go back and at least let my colleagues know and share with them what I've experienced and maybe just plant a seed. I mean, they will not even recognize me.
Mm.
I mean, I don't even look like the same person that I did before when I was there. So, I mean, I will end up going back and popping in, but I'd love to, if you have an opportunity, to tell them that this is all from the carnivore diet. And no, I haven't had fiber in 17 months. It'll blow their minds.
Yeah, I bet. I was actually going to ask you that, what your colleagues at work thought about this, if you had spoken to them. Have you spoken to any of them, or not yet?
I have kind of texted a little back and forth, but I haven't told them
Mm.
what's been going on. I'm just wanting to show up.
Mm.
And and you know, one of the problems with the reason why I don't just pop in is because one of the issues I had was with, like I mentioned, was with heat. And during the pandemic, I could not wear a mask. And everywhere you went, they required you to wear a mask. But the heat from my breath would trigger the throat swelling, anaphylactic type episode for me. In fact, it sent me home at the beginning of the pandemic when I was working. And I when they finally, like, they brought the patients back in, they had us cancel most of the appointments, and they brought the patients back in finally about June of 2020. And I already had the ability to work from home. So for about 3 months, they sent all of us nurses home that could work from home. And when they would bring us back in, like one nurse to cover patient visits. And so it was my turn to cover patient visits. And I ended up having a reaction because we had to wear the mask. And my boss sent me home. So Washington, the place where I worked, it seems like they can't quite give up the masks.
Mm.
And so I'm waiting. I keep checking online to see what their mask policy is. And so I'm hoping next summer that they'll give up the masks and let people come in without them. And so I can just drop in on my coworkers. But until then, I have to be careful. I
Yeah.
still have to avoid triggers. I can't stop
Yeah.
avoiding triggers. I mean, food is one component only of the mast cell activation syndrome. I mean, the histamine is one of the many mediators, one of the many, many chemical mediators. The mast cells produce. So it's one of many things. I cannot stop avoiding the triggers. I am testing my tolerances though. So I've been testing my heat tolerance. I've been pushing the boundaries now that I'm feeling better. And I feel like my heat tolerance is getting better. I could not shower very well. I had to take a lukewarm shower and I was so weak I couldn't even raise my arms and really to wash my hair. I couldn't wash dishes because of the heat. I couldn't be in the kitchen. With if anyone was cooking, I couldn't even be in the kitchen or I'd have dizziness, nausea, throat swelling, flushing. And so I've been testing those boundaries and now I can wash dishes. I can go out and I can hang out in the sun for a while
Nice.
and for maybe an hour and I'm okay. So I'm pretty hopeful and I may even be able to wear a mask now. I
Mhm.
don't know. I haven't tested that one. But it's something that I have a goal to do is to go back and pop in on them hopefully by next summer. Yeah.
Okay, great. Well, that's a good thing about living in Washington. If you can be in the sun for an hour, that's usually about all you get per year, like in the summer. So, it's like that was one of the reasons that I had to move a couple times was just that I would just get, there's so many cloudy days. I'm like, "Yep, that's enough of that." And I ended up moving to Tucson for a year and I had simply because it had the most sunny days of any city in America.
Yeah.
And now I moved to Australia, and I specifically chose Perth because it has the most sunny days
Sunny
in
days.
Australia. So of any
Yeah.
major city anyway. So that's it's just I just need that in my life, and so yeah. So that's probably good place to
It's
live.
a
Sort of like
it's a great climate for
yeah,
me.
yeah, exactly.
Although we had a beautiful summer. We had a lot of sunny days this summer. And and it is being out in the sunshine and being out in nature is
Mm,
extremely important, as you know. And so I unfortunately we did have a beautiful summer and it wasn't too hot, which was nice. And so I did get out a lot. My husband and I like to go geocaching, and there's so many fun places to go geocaching around here. And so that's kind of our thing to do is we'll go out and go geocaching and explore the area. And so I'm even testing my cold tolerance because I was starting
mm,
to get reactions with cold as well.
yeah,
And so I've started to go out like last winter, I was going out with just short sleeves and hanging out when it was 30 degrees and spending a little time out there and just to as much as I could handle. And so I feel like it's important to try to improve my resilience because my resilience was pretty much nothing before. And in order for me to really function in life, I have to improve my resilience. And I just feel like I can test those boundaries now where I couldn't do that before without feeling like I was going to pass out and having to
mm,
call 911.
mm,
Yeah.
mm,
But I can even handle UV rays now, which I, without having any rosacea issues and without having any flushing, no dizziness anymore with the sun. Um, I would have no dizziness with noise. Like we go to church on Sunday and I wasn't able to even go in until the music was over because just the vibration from the music would set things off. And I would have like my cells would start quivering. I'd start to get dizzy. And so now I'm okay with that. I actually have gone to a couple of concerts recently, and there is no way I would have been able to do that before. Well, first of all, I couldn't have fit in the seats,
mm,
which, was one factor, but just the crowd, the overstimulation, the noise, the lights, everything, just too much stimulation would set off the mast cells.
okay.
So I can actually do that now. So yeah, I'm going to continue to test my tolerance. Now I am still um, working on detoxing from the mycotoxins.
Mm,
And I'm seeing a naturopathic doctor still, and we're set up to do my third mycotoxin test. And the second one was better than the first. So I'm hoping that the third one is going to be even better, I hope. Um, but detoxing from mold is a little tricky. You have to be so careful. I mean, even someone without MCAS, if they've got some mold issues, have to be careful. You don't want to detox too fast or you're going to get sick.
Mm,
And but I also have orthostatic intolerance. A lot of people with MCAS also have POTS. They have
mm,
EDS. I do. My good friend Amy tested me when we met in Texas at Hack Your Health. She kind of ran me through the battery of tests because she's got EDS, and she
mm.
ran me through the battery of tests and stuff. And it turns out that I have a lot of the symptoms. So I may have a little bit of Ehlers-Danlos syndrome, just mild. But yeah, my orthostatic intolerance is something I still need to work on. And it's important too with MCAS that you work on your nervous system and work on the your vagus nerve and your parasympathetic nervous system, because it just doesn't work that well. I end up finding that sometimes I still do have some vagal reactions, and they just kind of happen seemingly randomly. So it might be the mold, and it might be just that I have more work to do in that area. And I've been doing breathing exercises and a lot of like core work, doing planks and trying to strengthen my core to help with the orthostatic intolerance issues. So that's been helping.
Good. So having true histamine issues because of the MCAS, there are people that talk about how like, certain foods, aged meats, leftovers, things like that, will cause some sort of reaction, and sometimes that's attributed to histamines. Have you noticed something like that yourself? Do you have to avoid certain meats? I know you said chicken, but like as far as like the red meats are concerned, does aging meat, does that cause a problem, or have you noticed anything
Yeah.
like that? Hey guys, just want to take a second to thank our sponsor, Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. For those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right, thanks guys.
Yeah, yeah. I haven't tested the aged meats again
Mhm.
because I'm a little bit nervous, because the last time I had aged meat was accidental. It was at a
Mm,
restaurant, and I ended up incredibly ill. My gut was just very unhappy, and I ended up with bleeding and severe pain, and it took quite a few weeks for it to clear up. And so there's so many histamine receptors in the gut, and my gut is one of my more sensitive organs. So I'm really, really careful. The only thing I'm allowing myself right now that has higher histamine is the bacon and the egg whites. And I do take a DAO enzyme before I eat them, just to give myself that little extra help.
okay,
Yeah.
interesting.
But my gut will tell me if it's too much.
Yeah,
I will end up with pain. Yeah.
yeah.
So
Um, I was just thinking, if MCAS is as common, 70%, that's nearly 1 in 5 people would have some
yeah,
sort of issues with this. That's extremely prevalent.
yeah,
And we're seeing people in the carnivore community that they eat certain meats and they have a problem with it. And
right,
there's a lot of interest in that. It was like, okay, why is some certain meats affecting people in certain ways, even if it's grass-fed, finished, perfectly pasture raised, all these other sorts of things. There seem to be some certain triggers that people have,
right.
and for some people that can be aged meats or leftovers. For some reason, they just leave things
Yes,
in the fridge and they just can't eat them the next day. They get a bad
right,
reaction.
right. And some people are so sensitive that they
Mhm.
can't eat any leftovers at all. They have to take their food once they've cooked it and they eat their portion. If there's anything left, they have to freeze it right away.
Mm,
And I'm fortunate. I'm not so sensitive that I have to do that. I can
okay.
eat it if it's been in the fridge for a day or maybe even 2 days. But yeah, some people are extremely sensitive. But that's why I want the carnivore community to
Mhm.
know. And it's not just mast cell activation syndrome. There's people that don't have mast cell activation syndrome that have a histamine issue,
Mhm.
which tends to resolve and not be a permanent issue. But there's people who may go on carnivore and they're like, but I don't really feel better. And it may be that they need to consider that it could be a histamine issue. Now, I do have a whole video on my channel that I did on histamine and the carnivore diet, and it's specific to carnivore foods, which ones are higher in histamine and which ones are lower, which ones are okay. And even have like samples of meals that you can do that's low histamine versus high histamine, and a lot of pictures and everything. I did it in a PowerPoint presentation. But I've had a lot of people comment that that's been so helpful, and it has answered some of their questions about like why they're not getting the results. Just like me, like I needed to do the lion diet, and it was funny because while I was doing the histamine video, it had been so long since I had visited my histamine list, which is this from the Swedish interest group. It's their histamine list. It's very, very thorough.
Mm.
Um, but I hadn't visited it for quite a while. And when I was working on this histamine video for my channel, I started to realize, oh my goodness, I'm eating things that are higher in histamine. They're carnivore. Something in my brain when I went on the carnivore diet forgot that I have to watch histamines. And I just went like, if it's carnivore, I'm going to eat it. And it was while I was putting that video together, I realized, oh, wait a minute, maybe this is why I'm not getting all the results to the extent that I need. And so I took my own advice. And that's when I cut them all out and I went the lion diet. So yeah, there's so many people out there that could be saying, oh, carnivore diet's not really working for me. Don't just throw the baby out with the bathwater. It could be that you need to go low histamine carnivore. And it's not just, okay, beef and lamb. It's like you said, how fresh is it? Is it aged? Is it smoked? You can't be, if you have histamine issues, you can't be eating a bunch of smoked brisket.
Mm.
Even fish, and I do occasionally eat fish. If you have a real problem with histamine, the fish that you find in the grocery store that's on ice, that you go and they wrap it up for you, that's not fresh enough. It needs to be fast, like flash frozen or freshly caught and, filleted and eat it. So some people it has to be that they have to be that careful.
Mhm.
And young cheeses, if you want to eat dairy, young cheeses are okay, but aged cheeses are higher in histamine. So and even butter. I only do sweet cream butter. I don't do cultured butter because cultured butter is a little higher in histamine. Um, so there's little nuances that, you just want to learn about and just test them out. Eliminate those things from your diet and then see. And
Mm.
I just can't emphasize how the dramatic change of just getting the higher histamine carnivore foods made for me. I mean, it made all the difference for me.
Great.
Yeah.
Um, yeah, when I find people that have these sorts of issues, I just tell them like, look, make a have a food journal and try to chronicle like how you're feeling and different symptoms you're getting, what you eat, when you eat them, and see if there's a pattern there, and if you have a connection, then you avoid those things. And if you don't see a pattern, well then okay, well that's good information too, because it can reassure you that it's not something that you're eating. There's something else going on, so you look for that. But as far as well, when people do find that they have issues and they do think it's a histamine issue, like you said, sweet cream versus cultured cream. I had no idea what the relative histamine levels would be. Do you know a good source where you found these things, or people can look into?
Yeah, yeah. The Swiss interest group histamine list
Okay.
is the best that I'm familiar with. And I'm part of a couple of Facebook groups. One is for mast cell disease and one's for hereditary alpha tryptasemia. And that's like what they say. Everyone there says this is the best list. It
Okay.
has so much. It even has food additives. It has all the seasonings, spices if people do use herbs. It
Mhm.
has every category, beverages. Yeah, so it's extremely thorough. So I always refer people to that. And very often people will come back and say, oh,
Mhm.
I didn't realize that this was it. And another thing when it comes to reacting to histamine, it's important for people to realize that the reaction, there's no cookie cutter for what type of reaction you're going to experience because a mast cell reaction can affect every part of your body, and everyone's a little different. So not everyone's going to have like the throat swelling, flushing, tachycardia like I did. I mean, it can make you a little nauseated. It can give you a headache. It could clog your sinuses. It can cause skin issues, heart palpitations. Like I would get the heart palpitations for sure, but I would also have issues with can't take a deep breath. So it could affect your lungs, could just cause joint pain. So be just very aware of your body and how you're feeling before you eat the food, and also that the reaction isn't necessarily going to be immediate. In fact, it's rarely immediate. It can be 2, 3 days later that you end up having symptoms, and depending on the quantity you eat and how sensitive you are. But it's something that I would, when I talk to people, I say, if you're going to try something that, like people who have mast cell disease and they've been on low histamine, if you're going to try something, just try it and then wait a few days. Don't just say, well, if I don't react immediately, it's fine. You need to give it a few days and make sure that 2, 3 days down the road, you're not having pain or some other symptom. Yeah.
Yeah. So that's very good advice. I mean, I think there's so many people, if mast cell activation syndrome, 70% of people, I mean, obviously no one, not nearly all the people that have this are going to even know. And so
Right.
if you're finding you get some of these symptoms, have that in the back of your head. Maybe this is something that helps. I mean, I guess the good news is that um, that carnivore helps. And as you notice yourself, even the triggers that would normally land you in the hospital, they're now things that you can tolerate more, and so the body does get a chance to heal and to calm down as well, which is really, really important. It is something that I've seen a number of people struggle with, and heretofore there have not been too many people that have um, tried carnivore with those issues. I mean, there have been, but it's not something that there haven't been a lot of interviews like this where people have said, "Hey, this is my experience." And
Yeah.
so there are a lot of people that have been struggling with this. I've seen a lot of people struggle with this, but the good news is that it can get better, and it does get better. But like
Yeah.
you say, you have to be very on top of it and very strict.
Very much so. And the diet is just one tool. And
Yeah.
just to let you know, I still do have to take a couple of medications. So I started out with a medication list between prescription medications and various supplements, some mast cell stabilizing supplements and some other supplements that just help support my immune system. I had about 30 things I was taking each day. It was a long list. And now of course, H1 and H2 blockers are definitely very important. And I've heard a lot of people, even people that are very much, you know, carnivores in the carnivore space, as far as healthcare providers, they still would recommend a period of time on H1 and H2 blockers just to give your system a chance to settle down, give your mast cells a chance to settle down. But the issue too with me was that I was on those, but it didn't help the brain issue. The brain issue, there's more H3 receptors in the brain, and so I ended up going on a medication called ketotifen, and it's compounded. Here in the US, you can only get it as an eye drop. And so I actually get it compounded into a capsule. And so I take ketotifen every day, and that really made a difference with my brain symptoms, the brain fog and the slurred speech and the word finding difficulties. And so that was a big deal. And then also low dose naltrexone. Um, so actually, it was I think low dose naltrexone was the one that actually helped the brain more than the ketotifen. The ketotifen helped a lot of the other symptoms. But I have tried to go off of the ketotifen, and not not able yet. I tried maybe 4 or 5 months ago to go off of it, and it looks like I still need it. It can take quite a few years to really truly heal and let everything settle down. And I don't know, to be honest, if I'm going to be able to go off of that medication. Um, but I'm thrilled to go from a long list of 30 things to two. So I don't want to pretend like, you don't necessarily, yeah, you can get off of all your medication right away. I got off of most everything within a few, yeah, 6 months, I'd say.
Yeah,
Yeah.
amazing. Well, the detractors will always say, well, you were already on treatment, and obviously that was just the treatment working. And of course, that's not true because the treatment wasn't working. Things were
It
getting
wasn't
worse.
working.
Yeah, exactly. And then when you made this change, you were able to come off treatment. So, these treatments don't make things better. They don't address the underlying root cause. And so they have to be perpetuated. They're going to deal with the symptoms, maybe, but they're not going to get rid of the underlying cause of this. And so it's something that you're going to be on for the rest of your life. It's not something that, oh, you're better now. So I mean, antibiotics, sure. You've gotten rid of this infection, it's gone now. You don't need to take antibiotics for the rest of your life outside of very specific circumstances.
Yeah.
But these sorts of things, no, it's not getting rid of anything. And so making this change and being able to come off medication is, it's very telling. I mean, it shows that this is actually addressing an underlying root cause, some of these triggers,
Yeah.
and allowing your body to get better, which is amazing.
Yeah, absolutely. And once I'm fully detoxed from the mold, I will probably try to go off of them again. And, because the mold is an issue, I can't assume, I mean, diet isn't gonna necessarily help with the mold issue. One one good thing though is that I no longer have sleep apnea. And so my sleep apnea completely reversed. I had been using a CPAP machine. I had severe sleep apnea. I had been using a CPAP machine since 2008. And probably 6 months ago, I I accidentally fell asleep without the machine. And I was fine. And my husband said, "Oh yeah, he wakes up in the middle of the night for work." And he said, "Yeah, no snoring, no apneic episodes. I didn't have any headache, no loss of energy." And so yeah, so that's good. So if it was my CPAP machine that was causing me to have the mold issue, that has been out of my life now for about 6 months. So
That is great.
I'm hoping that that was it, because I don't know. I mean, I
Mhm.
live in a damp state, but no one else in my household has any issues with mold, and so I'm hoping that was the problem.
Yeah,
Yeah.
hopefully. I've certainly seen that. I was an intern actually, and there was a guy who had, hadn't sort of changed his CPAP machine, and he was getting recurrent respiratory and sinus infections. And when we sort of addressed that, and well, and also he wasn't using distilled water, he was just using tap
Mm.
water. And so it was like, ugh, that's not always what you want to do. And so he had a sort of a dirty CPAP machine with tap water, and he was just getting these recurrent infections. And when we addressed that and used distilled water and cleaned things out, it resolved. But he had some chronic issues for a while, but they eventually did resolve. But he had sort of deep seated sinus infections and things like that because of that. But yeah, so that definitely can be a thing. Um, well, Lynn, thank you so much for taking the time to come on and speak with us. It's absolutely wonderful hearing your story. I'm so glad to hear that you're doing so much better. I mean, it is actually remarkable to see that sort of recovery and that level of recovery. And so I hope other people that may be suffering with this, well, I hope no one's suffering with that. But if I'm sure that there are, and so if anybody is, hopefully this gives them a bit of hope that there's a light
Yeah.
at the end of the tunnel. So thank you so
I
much.
just I just hope that people who have been struggling with odd symptoms and no solutions and going from doctor to doctor will at least consider that this might be the problem. And if
Mm,
that is something that comes to their mind now, then that's great. Maybe they can get a diagnosis.
yeah, definitely. Well, then, thank you so much for coming on. Would you be able to tell us where we can find you? Would you name your channel on social media so people can follow you and find more?
Yeah, absolutely. So my channel name is Midlife Carnivore, And you can find me there. You can find me on the healinghumanity.life membership site. You can also find a couple books that I've co-written. If you look up my name, these are carnivore books for kids.
Oh,
So I've got
nice.
this
Yeah.
one. Some of the proceeds to this go to the Healing Humanity documentary. And then we've got this storybook, which is based on Dr. Barry's kids.
Hmm.
And some of the proceeds for this go to the American Diabetes Society.
Oh, very
And so
good.
if you look up my name on Amazon, you will find those books. So that's another way of connecting with some of the work that I'm doing.
Very good. Well, thank you very much for that. And that's great that you're putting out kids books, especially.
And there's more to come.
Yeah, good. I get
Yeah,
that. I get asked that all the time. Are there any is there any medium to address the, proper nutrition, proper nutrition with kids, because it's not something that they have. Everything is dead opposite for
exactly.
your spouse. So
This
that's
is
great.
why we did these books. And beef, bacon, butter, and eggs are superheroes. And yeah, so we turned them into superheroes. And the
Nice.
first book is a comic book, and it also is a coloring book and activity book. And so there's all sorts of fun activities for kids to
Mm,
do. And it is a way of combating all of the messaging that they're receiving through the media, all the ads, and to help parents and grandparents, give their kids and grandkids something that will give them a different message.
perfect. Well, that's great. Well, thank you so much for doing that. If anybody would find that useful and helpful for having these conversations with their kids, please do check those out. And you can also check out the website for histamines as well, which is a great resource. Was that's not I didn't even know where to look these things up really. So that's great to have that in one area. So, and please do follow Lynn and see more of her work. Lynn, thank you so much. It's been an absolute pleasure.
Thank you.
Thank you. And thank you everybody for watching. I hope you enjoyed that. If you think this would help someone, please do send this to them and let them know there's hope. Thank you all very much. We'll see you next time. Hey guys, thank you very much for taking the time out to listen to what I had to say. If you like it, then please like and subscribe to my YouTube channel and podcast. And if you're on YouTube, then please hit that little bell and subscribe, and that'll let you know anytime I have a new video out, which should be every week, if not more. And if you could share this with your friends, that would help me get the word out and let me know that you like what I'm doing. Thanks again, guys.